Hello and welcome to the third CTIS walk-in clinic. My name is Roxana Spulber and I am a Change Management Officer at EMA. So let's start with some housekeeping rules. We will be using Slido to collect questions. Here is how to use Slido. Go to slido and enter the code on the screen, Clinic 3, and scan the QR code on the screen. The code and the QR code will be visible on all the presented slides for ease of access. You can ask your questions there and give a thumbs up to any questions you want to see answered. We will answer the most popular questions first, so please ensure to use the thumbs up feature. Please keep the questions focused on CTIS functionalities. If the video screen is blurry or difficult to see, please read the instructions in the gray box underneath the video on the event page. There you can find a link to watch the live broadcast on full screen. In full screen mode, you can increase the video quality by clicking the HD button on the bottom right of the screen and choosing the 720p or 1080p setting. I will now introduce some pieces of useful information related to CTIS. The second clinical trial has been authorized through CTIS. It is the first clinical trial initiated via CTIS, i.e. it's a trial that was not previously ongoing under the clinical trial directive. And the member state concerned in the trial is Denmark. Patients, healthcare professionals, and members of the public can see relevant information about the clinical trial in the CTIS public search, such as the estimated recruitment start date, inclusion and exclusion criteria, and sponsor details. More information about CTIS and the CTIS public search is available at euclinicaltrials.eu/home. CTIS allows sponsors to upload for publication and not for publication versions of certain documents, including the protocol and the investigator brochure. This functionality allows sponsors to protect personal data and commercially confidential information. To assist sponsors and authority users in fulfilling the transparency requirements set by the directive, EMA has been developing a guidance on how to do this, and has published a draft of the guidance for open consultation to allow for wider stakeholder input and to account for experience gained in working with CTIS. The draft guidance and the details on how to provide feedback can be found on the CTIS training and support page. The deadline to comment is 8th of September 2022. A stakeholder workshop will be held during the public consultation period, and further details will be shared in the clinical trial highlights newsletter when available. For more information on CTIS, you can consult various resources. Some of them are listed on the slide. The clinical trial highlights, as mentioned previously, that provides key updates on the development of CTIS and also includes topics such as Business Change Program, ACT-EU, the Clinical Trial Information System training and support page that contains training and support materials aiming to help users comply with their obligation under the clinical trial regulation, And also, if you need more information on CTR interpretation and national guidance, you can consult the UDRALEX Volume 10 Clinical Trial Guidelines. I would like now to introduce you to our experts. We have today with us Noémie Manon, Principal Scientific Administrator and leader of the Operation Workstream for the Clinical Trial Information System, enabling the application of the Clinical Trial Regulation, and Ana Rodriguez Sanchez Beato, our CTIS expert and project workstream lead, and has been involved in the implementation of the clinical trials regulation and the development of CTIS, providing a business perspective. I am now handing it over to our experts. Welcome.
Good afternoon, colleagues. Very nice to see you again at this walking clinic. So here we'll do obviously our best today to answer most of the questions. But as you know, this session has been quite popular, and we will certainly take the most important question and the question coming up first. So good afternoon, and anyway, look forward to your questions.
Hello, good afternoon, everyone. I just to say, as Nomi has indicated, you are very welcome and raise your question. Hopefully, we can answer those more popular. We may not know some of those, but we will try to refer to those documents where you can find also information as well. So let's see how it works and how much we can do today. But hopefully, you find the session useful.
So I think in the meantime, Roxana will share with us the Slido screen on which you're probably currently populating questions. And Anna and myself will do our best to answer those. And I think, Anna, this is probably the fourth walking clinic that we're having, that the EMA is scheduling, isn't it? Yourself and myself have already done, I think, 2 together.
First one, we did the first one.
Yeah. Very good.
I think this is the third one, but no, fourth one. I don't remember. Probably Rosanna is in a better position to answer the question.
But I think so far it's been very well attended. We've had we've actually got the statistics on the number of people who were joining, and that's quite significant. It was more than 100 people logged in, so I guess it's a popular forum.
In the meantime, if you don't mind, I will read the questions till I sort it out. Oh, I just received confirmation that they can see Slido. So
oh, very good.
Yeah, I will read the first question, and maybe one of you can start. So, any update on when a template for compliance with regulation will be available?
Okay, so Anna, shall I start and then you can complement?
Okay.
So I think this is in relation to the compliance with GDPR. I think this is a template that is currently being discussed, and that's what I'm aware of. So I don't think at this point in time we've got it yet, but I think it is being thought of and considered. And now, could you complement?
No, yeah, just to confirm that unfortunately this template is not available yet, but the clinical trial expert group that is being led by the Commission has in their plan to prepare this template, but there is no specific due date yet when this will be done. But hopefully, perhaps by the end of this year, it will be something available.
And maybe we could say that if the sponsor is having any query on that particular topic, they could always send us a query to the help desk, and we will do our best to provide you with at least the content of what is expected. But this is very much in relation to GDPR, so it's not really an awful lot of secrets on what it needs to include.
Okay, thank you. The next one is regarding country readiness. So a company received a validation issue from Bulgaria asking to withdraw the application in the country as they are not ready yet. Do we have any information on this? Should the sponsors not submit in Bulgaria?
Okay, so on the readiness of member state, I think what we've communicated to yourselves and in previous sessions, and also with our stakeholders and with the support of the member states, is that the member states have all received login credentials. They've all followed some training, And from the 31st of January 2022, they can certainly access the system and they are ready to receive applications. So this is what we can comment on. Now, on this particular event that was mentioned within a consideration, I don't think the EMA is aware of that particular event, but if there is such concern, I think you should certainly go back to your application and certainly discuss that with the RMS. Anna, would you like to supplement that response?
Yes, I think from, as Noemi has indicated, I mean, we had organized a lot of training activities, even hands-on in the system with them to get ready for the go-live date, and they have all the users with the required roles to work in the system. So therefore, I mean, the expectation that all member states are ready. If that is not the case, I don't think EMA is in the position to answer this type of question. You may need perhaps to liaise with the Commission to report on this. So that's what we can say from our side.
Shall I read the next one?
Yes, please.
Yes, please, Roxana, thank you.
This one is on transitions, and it reads, sponsors can either submit a harmonized protocol via substantial amendment under CTD before transitioning the trial, or submit a consolidated protocol. Thus, this consolidated protocol refers to the protocol and annexes of all the local protocol amendments.
Okay, so I think this is an important question about transitioning trial that have been authorized under the the Clinical Trial Directive. So the way to operate and what we need to think is that when the information is transitioned to CTIS, all the documentation needs to have been authorized prior by the member states concerned. So when we talk about harmonized protocol, we certainly want to see a protocol that is harmonized, that is consolidated and submitted to all member states under the CTD. So the way to operate is that if the protocols under the CTD have not been harmonized, then you would need to submit substantial amendment under the CTD in order to make sure that you have one consolidated document that encompasses all the changes or all the setup in all the different member states.
Great, thank you. So let's move on to the next one. When we are not able to respond to RFI in due time due to a pending site document, can we get Part 2 approval for other sites for these MSCs? And two following questions. Can withdraw lapse this MSC from the Part 2 submission? Will it be published in case of a lapse? Any impact on the Part 1 submission for this MSC or other MSCs? Thank you.
So I think on this one, so maybe shall I start, Anna, and then
you can because the letter is so small here that sometimes it's difficult to read the question.
So I think what we need to understand is that the approval in an MSC is valid for all the sites. So in this event or in this scenario here, we're asking whether, in case you cannot provide a document for a particular site, what should you do in case of a response to an RFI? So obviously you don't want your RFI to lapse. So what I would suggest in such a case is that you provide all the information that you can provide, and then you inform the member state concerned that there is a pending document. I'm sure you can have this conversation with them, but please do make sure that you do not have your RFI lapsing, because otherwise you will have to start from scratch again. So certainly do that, and in such a case, the MSC will certainly consider the fact that you could not provide one particular document, and they will certainly issue their decision accordingly, with potentially this document missing. So it depends how critical it is. I cannot think of an example, but this is very much the approach that we suggest. So obviously, if for this particular site, let's say for this particular MSc, you have many documents missing and you cannot meet the timelines of the RFI, then this is more critical. In such a case, if there's so much documents to provide, the withdrawal in that case is probably the answer, and then you would complete and then you would need to resubmit. But obviously there is no range of scenarios when you cannot provide all the documentation. But I think if you've got most of it, you should certainly provide whatever you can and inform the MSc accordingly in such a case. So within the question, there's also whether the information is published in case of lapse. So the information would not be published if an application has been withdrawn or has lapsed, because in such a case, there's been no decision. And we need to understand that the publication trigger of an application is always the decision. And whether the decision is positive or negative, the information is always published. But in case of a lapse, there's been no decision, so it's not published. And then the end of the question was any impact on the Part 1 submission for this MSc or other MSc. So I guess this is in case this particular MSc had their Part 2 RFI lapsing, I guess. This is in such an event. So if the RFI from the Part 2 assessment lapse, then this MSc will not have a decision because they can't make a decision, obviously. But then all the other MScs can certainly make submit an informal decision, as long as obviously they were able to assess the Part 2 as well. I hope that answered the question, because I took the scenario of the RFI for Part 2. Thank you. So I'll move on. So maybe we can take the next question. Anna, is there a question you would like to take from that list?
Well, I was looking at the second one on the location ID missing in CTIS or MS. I presume this is related when you search in OMS, you have listed the organization and they are grouping by organization ID. To be honest, I don't remember. I presume is there where you miss the location ID, and as far as I know, we don't have any intention to have this information there in the system. You will have the address, and that should be the basis to select the site. I don't know. I was trying just to check in the system, but I have some issues, so I cannot reconfirm that. So that's what I can say for this particular one.
Okay, thank you very much, Anna. So the next question is on the size file. So currently, as we know, when the sponsor is uploading a document, the size file is currently limited to 10 megabytes. And this is correct that we want to increase it to 50 megabytes, but we don't have yet an understanding of when it will be done, unless, Anna, you do. But I don't think we have that clearly in our minds today.
No, not yet.
Not yet. Okay. So then I must say the next question is written quite small. It's quite smaller.
I would appreciate if you can write the question in
sure.
bigger font, because sometimes it's difficult to.
I'll read it to you. So when adding a study site, the department name field is mandatory, yet some smaller sites do not have departments. Should not applicable be entered in this case?
Okay. Right. So I think if you say that some smaller sites do not have departments, I guess you may want to then enter the specialty of the investigator, because most of our investigators have specialties, I guess. And this was the reason why there was a department mentioned there to really have some understanding of where were the investigator, where was he based. Now, if you think that this is an information you cannot provide, you can always enter not applicable.
I think for country readiness, I think we already answered this question in the context of Bulgaria. Again, EME is not, I mean, from our side, we have done all what was in our hands for member state to be ready. And the expectation is all of them are ready. If you have issues, then you should liaise with the Commission for that are responsible for the supervision of the compliance with the regulation. Regarding the next one, again, it's a little bit small. Do we have to submit an authorization letter for the submission by a CRO with a trial-centric approach? No, I mean, again, to use CTIS, you need to be assigned a role. So if you use the city-centric approach, how it works is that you can only create clinical trials via the city-centric approach in the case that there is no sponsor administrator registered in IIM, because if there is one, you will be enabled to do so. And therefore, any user can create a clinical trial via the city-centric approach, but again, under the condition that for the sponsor organization you have selected for the trial, it does not exist a sponsor admin. And therefore, then from that moment you create a trial, you become the city admin and you can perform all the activities in the system. How you will initiate the creation of the trial, because you as a CRO have a contractual arrangement with a sponsor to start doing that. This is something it's outside CTIS, and it's something you need to do as you do with normal business among contract research organization and sponsors. So this is outside CTIS, and I presume the contractual arrangement you will have, okay, please create this trial via the city-centric for our sponsor organization.
Okay, thank you very much, Anna. So the next question that we see on the screen there is for which documents we need to create track changes document copy when updating a document. Is that for all documents in part 1, in part 2? Is there some documents that we could we don't need, for which we don't need to create track changes? So the track changes requirement is quite clear in the clinical trial regulation. And I think we need to be practical here, because the track changes is really required when there's a lot of changes. And that's, I think, now what does it mean, a lot of changes? I think obviously it's up to you to think when it is required. Member states are quite keen on the track changes because it will facilitate their review. I think I've heard them saying that the track changes documentation enable them to really understand what was changed from the last time they've actually reviewed and authorized the document. So I think this is very much for to facilitate the review, and it is for you to think to what extent, how much have I actually made changes to my documentation? How can I actually facilitate the review by the member states? And obviously that can apply to part 1 and part 2. And we can't really give you an exhaustive list exactly of what and which document. But I think it needs to be understood that it's in case a lot of changes have been made. And this is really to facilitate the review by the member states.
So for this one, the designated PI need to sign the protocol at any point in time. This is not defined in the clinical trial regulation. I have to say, for this, I think as you indicated, if it's not defined in the clinical trial regulation, it's not a legal requirement, and therefore, and also bear in mind that we need to comply with the GDPR that documents should not contain personal data as well. So But for this particular question, I don't know, Noemi, if you have been involved in other discussion or meetings where this question has been raised, but I'm not aware that this is a requirement. But
no, I think I don't have anything else to add. I think you've said it, and it says in the answer. The answer is given to the question, really. Yeah. So the next question that I see there on the screen at the top is when a study is temporarily halted, no notification can be submitted for this particular study. So in case further notification would be required, how should we do it, basically? So if a trial is temporarily halted, obviously, in such a case, the trial in that member state, because temporary halt is per member state, obviously, in such a case, there will be a limited amount of information that can be provided to the member state. Now, I don't know if you had in mind a particular notification. I can't think of one particularly, but if you do, maybe you can further clarify it in your question. The notification that are on top of those would be the serious breach, etc. So in case the trial is on hold, I think the sponsor can still provide to the member state even notification that the study would have been inspected by a third inspectorate. So I think we will need to clarify exactly if you had in mind a particular notification. Because obviously, if it's on hold, you wouldn't be able to say that you're going to start the trial or end the trial. End the trial, I think you can still do it. But obviously, start the trial, no, because it's on hold. Huh? Okay, so then we can take the next one.
Okay, so the next one, if one site is registered in OMS with a wrong address, is it acceptable to include this site in CTIS, or is mandatory to have the address corrected in OMS before including the site in the submission? I mean, again, here, you are a sponsor are responsible of the quality of the data of the dossier. So if the site address you are looking for is not in OMS or is incorrect, then you need to raise a ticket to OMS to make that correction. So if you send a site that finally, for whatever reason, the address is wrong, then this application will go to the member state, and the member state will be responsible for the evaluation, and they may raise questions because of this particular inconsistency. So that's what I can say at this stage. So my recommendation is that you ensure the good quality of the dossier that you submit.
Okay, thank you, Anna. The next question is on the structured data. Structured data form on the EMF's website was updated on April 30th. But you can't find a record of the changes that were made since the last and the previous version. I think we take note of that, and we will certainly review the way we update the information on our website in case a change or an update to a document is prepared and provided to you. I think that's a very good point. And thank you for the comment.
Yes, I think it's a good point, and we will follow up because normally it's a best practice to have a change log, and I think there were a few changes because comments that were raised on inconsistencies that were identified from the experience with the production environment. So there's not the big changes, to be honest, but we will take that on board. We will check if there is not change log or is not so evident, and then we will ensure this is corrected for the next revision. Thank you.
So I think the next question it's on the national requirement for investigators qualification. In the current application, 2 MSc want to have not only documents of the PI per site, but also for a deputy. There is no reference in the CTR for this. So in fact, I would want to go. I would want to say that you're correct. There is no reference in the CTR to say that you should also provide the qualification of the deputy. Now, it's very difficult without seeing the protocol and the study itself, because maybe the deputy is having a particular role, and maybe the member state would like to confirm. Now, it's very hard to respond and to say that you should reject, because, again, it really depends on the study itself. So I would probably suggest in such a case that you go back to the member states and further clarify why it's needed, basically.
Perhaps we can see if we can answer this one. Regarding the third parties to be added to the sponsor section in CTIS, for those that have a contract with an affiliate, should we add them under the sponsor? In case we have a co-sponsor, we will need to add these third parties to the co-sponsor section when relevant. I think the third party, for the first one, when I presume a contract with an affiliate, I presume it's an affiliate of the same sponsor organization. And here we are talking about the third parties, not a sponsor affiliates. So for example, CROs that you may be working with that are doing different activities, IVRS or labeling or auditing or whatever. Regarding in case we have co-sponsor, we will need to add these third parties to this. If the contracts are with the co-sponsor, my view is that would be the case. So, but again, this refers to third parties, not to sponsor affiliates as such. That's my understanding. But perhaps this type of questions, perhaps this is something that Noemi, we may want to clarify in the sponsor handbook, because I think are good points and may need clarification.
So no, thank you. So we'll take note on that particular one. No, thank you. The next one is about will the EMA perform any reduction check on reduction? So I guess we'll perform some check on redacted clinical documents to be publicly released in CTIS. So I think so this is related on whether EMA would verify the information before it's made publicly available to CTIS. So the answer is no. EMA will not conduct any verification of the redaction of documentation that have been submitted to CTIS. This is not an activity that we will do at the agency. We can certainly confirm that.
Okay. Here there are hundreds of data elements in the CTIS structured data form documents, but not information on which the federal type maps to specific data elements. I think here the deferrals are more linked to the type of trial. So a document or a data field, maybe the deferral may be different depending on the type of trial. Is it phase 1, phase 2, phase 3, phase 4? So what we have now in the CTIS structured data form is we indicated that field will be made publicly available or not, but specifically the deferral, as I said, will be different depending on the trial. So the rules that will apply will be different depending on the trial. If it's a phase 1, it will be more deferred the publication. If it's a phase 4, it will be earlier for the same structured data and documents. So,
and just to
in any case, perhaps we can take note if there is something that we can do with regards to this to make things more clear. But Noemi, please go ahead.
Yeah, and to complement what you were saying, and exactly, there is the intention to look at the deferral training and to further clarify the deferral of the documents and fields, because I think we've had a few questions on that. So there is currently, it's currently in our pipeline to look at and to see how we can better explain the deferral on these documents and structured data.
It is true that some data and documents will be made publicly available at the time of the decision by default for all the trials. So because we can highlight those. So therefore we will take note, the same as for the third countries, and see if we can do something here.
So thank you very much. On the next question. So the next question is again on transition. So when a trial considered transition to EU CTR, when the first MSc decision is received, or when all MSc decisions have been received. Okay, so I think it's quite clear that as soon as you have a decision from an MSc on this trial, as soon as you have the decision, then the sponsor will need to fulfill their obligation according to the clinical trial regulation.
Where should the track change of the documents be included in the RFI response or in the CTA? So do you reply to the RFI and you make changes in the dossier? You have a section, automatically it will be displayed a section that you have to attach a document with the changes you've done. And also in the cover letter, it's expected that also you provide information on the changes.
Mm-hmm. Yeah. And to further clarify, because I think it's true that what we need to think is that this track changes needs to go along with the actual document that is then coming to update the previous one. I think the member state from the last interaction that we had with them were expecting these track changes to be shown alongside the document that has been updated. So not quite within the RFI response. So I know you've got a placeholder within each response, and each question has a placeholder for attaching a document. So it's not expected to see this document there, because we need to think that when the information is then published, what is rendered to the public is the latest version. So it would be the latest version with the document that has been updated, plus alongside the track changes document. So thank you. So the next one is, what is the expectation for the declaration of interest of the PI? This is not mandatory section CTIS, only upload in case of positive interest, or upload and submit as part 2 by default. So I must say, on this one, I am not competent to actually answer this question. I can't. I'm familiar with the declaration of interest of the PI in third countries, but in Europe, I'm not too familiar with this particular request of the declaration of interest. So I don't know, Anna, if you can answer that one.
Not either. Probably then this type of question are not specifically related to CTIS functionality as such, and probably the Commission would be in a better position to answer this type of questions.
Yes, because in fact there is a template for such a document within volume 10. So we probably need to have an interaction with the Commission to further clarify on that particular document and how should sponsor submit it and where, I guess. Okay, so on the next one, would you like to take that one, Anna?
Yeah, I can take it and you can complement as required. In exceptional cases, the RMS and the MSc could decide on additional actions leading to changes of the Part 1 as a result of the considerations from the additional member state, either through the decision of the additional member state or through corrective measure as described in Article 77. What does through a decision of the additional member state mean? Well, in this case, if there is a need to change, as I said, the member state may apply a corrective measure and indicate it, please submit a substantial modification, or there could be that in the additional member state decision, it's approved with the condition that you submit, as just giving an example, a substantial modification to do this and that, and therefore then you will do it without the need of applying a corrective measure. So that's what comes to my mind. I don't know, Noemi, if you have been involved in other discussion around these particular questions, that you can complement on that.
No, I think that was a very good answer. I don't have nothing to add, Anna.
We are approaching the end of the Q&A session, so to speak. So please take one more question or two. And then we go to our closing remarks. Thank you.
Okay, thank you very much, Roxana. So the next question that we see there, are there any countries following their shorter national timelines instead of the CTR timelines, especially when it comes to mononational countries? Mononational CTAs, absolutely. I think the CTIS is obviously showing the timelines that are advertised as being the maximum timelines, and member states can certainly assess in a much quicker fashion. I think this is well understood. So please, yeah, this is correct. I think Roxana, we can't. Yeah, there was a screen on, so we can see now the next questions. Should we take that one, Anna? Or?
Let me read it. Should close sites within a country where the study is ongoing, other sites open, need to be included in CTIS during transition? No, I think you should include in the trials that are ongoing, as far as I know. But I think that's a good question, and I don't think this is specifically clarified in the Q&A from the Commission. Do you know, Noemi, if this has been raised in other meetings or fora? But I mean, what it has sense is to have information on the active sites, not on those that have been closed. But perhaps this is something that we can indicate to the Commission if this can be clarified, because I don't remember to have seen this in the Q&A. So,
yeah. No, you're right. I haven't seen it either, but I think it's only the current open information, obviously, that what is active that should be submitted to CTIS. Yeah. Okay. So, shall we take the last one, Roxana? Do we have time?
I would suggest, okay, take this last question, and then we will go to the closing remarks. Thank you.
Okay, so thank you very much. So I think the last one is probably related to the temporary halted studies, where an urgent safety measure may be reported to a trial on halt. And I believe that today it is possible to do so. If the trial is on halt in a member state, the member state can still, the sponsor can still provide notification of USM to the system. Should be possible. Okay, thank you very much.
thank you very much, all. And I think for some points we took note, and we will see if this can be addressed in Q&As or in training material as indicated.
Okay, so thank you for attending the CTIS walk-in clinic and bearing with us through the technical difficulties. The post-event survey will be open after the close of this event, and you can share your satisfaction with the event. You can find it on the event page under the post-event service section. A recording will be available on the EMA website following the event. Please sign up for the City Highlights newsletter for information on when the videos are available. The questions will be used as input to EMA training and support materials. We would also like to remind you of some next events hosted by EMA on CTIS. On 19th of May and 2nd of June, we will host the next sessions for the CTIS walk-in clinics, and more details are available on the EMA events page. And on 31st of May, we will have the next bite-sized talk on modification on the clinical trial application. We hope you have enjoyed this walk-in clinic, and we look forward to hearing your feedback on the post-event survey. Thank you.